Hello and welcome to Yashoda Hospitals. I'm Prathyusha Chowdary hosting Nursing Education and Training webinar series live on Facebook every Thursday at 3 p.m. So bringing for the most interesting topics for you. Thank you for joining us today. Stay tuned till the end for the expert discussion. Also, you can post your answers, also the queries in the chat section, which will be addressed during the webinar, also at the end of the webinar. Again, we are back with a very interesting topic that's on contest on healthcare communication, a fundamental element for nurses. So without further delay, let me introduce for the pros of today's webinar. I take the privilege of welcoming our speaker for the day, Mrs. Shanti Bhattacharya, ma'am, our VP Nursing, Yashoda Hospitals, Hyderabad. We welcome you, ma'am, for joining us today.
Thank you, Prathyusha. Hello, everyone.
Ma'am, I have a question for you. Why did we chose the topic on healthcare communication as a fundamental element for nurses for today's discussion?
Okay, so hello, everybody. And today I'm here present in front of you all. I welcome all the viewers at this platform. And good to start and good questions which you have quoted to me, Prathyusha, saying why I have chosen this topic. Yes. Earlier, previously also, more than this webinar session, we have run quite a few communication styles and communication webinar sessions as well for this, the moment we started this webinar session. Today, why I have taken this healthcare webinar session is because if you look at our extreme scopes and facility at Yashoda, and since we have grown with the 4th unit as well, we have large and very extreme super scopes and multiple departments who is working with us, and the majority of the healthcare professionals and workers are from the medical team. So this is a thought process which we wanted to enlighten to the nurses fraternity, saying that the complete communication style to be understood by them. So I have chosen this topic, and I'm sure will be helpful for the same. Yeah.
Thank you, ma'am. So can we start the session now?
Yes, we can go ahead.
I'll share the slides for you.
Okay. As there is a say by Drucker Peter, who was a communicative style expertise, it is nothing but it is the verbal and written information that healthcare professionals or workers provide to patients to ensure individual decisions that enhances health. I am sure that everybody, do their communication style in a different way, by writing, by talking, by, having a formal and informal ways of communication. So that is how we practice this concept in the healthcare setup, so that, effectively everything is communicated to everybody. So when we look at the types of communication, we have 4 major communicative styles. One is verbal, non-verbal, written, and formal. These are all self-explanatory, jargons which we use in daily to daily life. Verbal is when we want to express our ideas, opinions, and we use make sounds and talk. This is nothing but we are talking. Yeah, when we present now, what I'm doing is verbal communication as well. So non-verbal is again when we are in the situations when we cannot talk and we provide non-verbal cues. So that is how non-verbal communications are being made. Written communications are very, very effective communication, where you see our nurses, they document a lot of things. Our doctors, they document a lot of things. So written communications are always, we write. When we write, also one is to make sure that we write effectively by using proper grammar, sentence formation. And because this is very effective means of communication, it is used for the record and reference purposes as well. When we talk about formal, the ideas and formal exchanges of information, ideas, some formal mails, all that comes under formal communication. Now, when we want to talk about the elements, which is very important, elements of communications, which we, all of us, all humans, we all practice, like in the hospital setup and everywhere in social setting also. So there's 3 to 4 things, elements, like sender. The sender is sending the message to the receiver. Let's say if at all I want to give a small scenario here, sender is a nurse and receiver is a technician. Sender is a nurse who says hello. She calls the department and she tells the technician, that I have already taken the appointment. Shall I shift the patient at 11 o'clock? Receiver, he checks or she checks the appointment schedule, and he says there are 10 minutes due. You can shift your patient back. So message is already been conveyed. Feedback is already received, reciprocated from one end to another end. The patient is effectively shifted to the department. So these elements of communication failing or lapse in this elements also, we have a lot of communication issues. So we should always have our golden thumb rule for following this element of communication.
So a closed loop communication is also a part of this?
Yes, closed loop of communication also is a part of this element of communication.
And can we discuss some kind of case scenarios which can enlighten this audience?
Sure. I have, very three. Now, before that, we would like to talk about basic communication skills. We all have very, very basic communication skills. If we don't go for very higher communication skills, if we have a nurses under us, we always teach them how to use the basic fundamental communication skills. So when we talk about the first one, which is active listening. Active listening is very important because many of the time we don't do that. Active listening is nothing but not only you're listening to understand the situation, you are listening to understand the situation as well as confirming also. If I just listen, but when it is asked back from my end, but I'm not able to tell, it means I have divided my attention to the communication listening. So here we are not supposed to deviate our attention to the listening. We should be doing attentions and the listening skills, both. Then only we understand. Second is the quick listening. You understood the listening, scenario, and then your response is very quick and very prompt because you understood the scenario. That's all. You are very promptly and quickly responding to it. And the third is understanding different communication styles. Maybe here we little fail to understand because every individual has their own practice of communicating or own styles of communicating as per their personality trait, their credentials, their competency level, their multi-diverse cultural issues, all that. So when we talk about this higher strategies of communication, we also have an assertive nature. Assertive is very cool in nature. Like they always respect the opinions and ideas of others and they communicate very soberly. Second is again your aggression, where you want to just convey the information in a very strong way, because maybe after having 3 to 4 attempts of communication, fifth time you might have lost your temper and you must have been very aggressively you have communicated. So that is also one sort of communication. Again, one is again assertive. Assertive again cool going. Cool going means you just you take the views and ideas, opinions of others and you just let it go with the flow. And the fourth is passive aggressive behavior and communication also. Sometimes we just want to be a little indirect in nature, but then we are doing all the rules of communication. So this is how we have a different styles. These different styles of communication is a little complex in nature, where the receivers may not understand what kind of communication is being conveyed to them. So here we need to practice and we need to understand the different hierarchy and super top people. So then otherwise, even our patients also. Sometimes all the patients are not very assertive in nature. Sometimes they're a little bossy, they're demanded, all. So that is how we have to understand the communication styles. It is only known to you the day you visit your patients and you understand, yes, my patient is from this background. Then you are very super, you take a lot of utmost care to understand them and he goes out of the hospital in a proper way. Second is empathy again. Third is empathy. You feel for others. You place yourself in others' problem and situations and you give a quick resolution for the same. Fourth is again body language and non-verbal cues. Body language is again, maybe you are not talking, but if your body language is not proper, it is also wrongly understood by this receiver. Non-verbal cues we also use when we don't understand the signages or the communications sometimes from the patients. Sometimes we see a patient from international countries. We see a patient from some different states. Though we communicate, but sometimes we use a lot of our non-verbal cues like the signages, whether he or she had finished food, whether how was the sleep last night, whether are you happy here. Those sort of like I would like to say that emojis kind of facial expressions are also being used. Hand coordination and eyes coordinations are being used. And the last one says writing and reading skills, which is very important. Again, very effective ways of communication. Writing is again, as I discussed in the previous slide. Reading also is very important, because here, if I talk about a nurse who is unable to read the doctor's order, then she will not be able to, provide the good coordinated care to the patient, because she's failing to understand the reading skills. So I always urge the nurses to read the orders, so everything, you get familiarized with the orders which is written by the consultant or anybody else.
Shanti ma'am, if you give me the chance to prioritize the three of the topmost things where we find most of the challenges in basic communication is like active listening, body language, that is non-verbal cues, especially understanding the different communication styles. And the topmost, which I have to tell you, is writing and reading skills.
Okay, so you want me to highlight again, repeat those all the one which we have spoken just now?
Yes, we wanted to do it in the case scenarios so that people can understand much.
Okay, so let us run the few case scenarios, then I will be able to tell you. So here, to analyze the scenario for the nurses, very simple scenarios I have made. Let's say if at all I talk about my case scenario, which is number one, Miss Rita. Just listen or read properly so that you will understand. Miss Rita, a 65-year-old housewife who was recently diagnosed with diabetes and is obese patient. She has made her first visit to the hospital to see a doctor. Following her appointment, she enters the OPD and asks for a nutrition counselor, because it is she's a diabetic client and she has come to see the doctor. Doctor has already done the appointment, but again she wish to see the nutrition counselor as per the order. Second is receptionist. What is her the reply is she advises her to come over tomorrow, and she did not pay attention to the patient. So this is nothing but the courtesy. Here the lack of courtesy is seen. Here the patient who is entering to the setup for the first time, she should be given a lot of proper orientation. Communication should be given to her so that she is guided and oriented to the system. Here,
so I have a question from this case scenarios.
Yes.
What do you think? This is a question even audience can also do answer in the chat section. Meanwhile, when we are discussing on the same part. So the question is for the audience and also for our speaker. So what do you think, what has gone wrong in order to find solutions to her health problem? So option A is lack of basic information and simple courtesies. Option B is absence of attention to communication. Option C is healthcare workers did not have required skills. Do you think it is all the above? So what is going wrong?
Can you view in the chat box whether the nurses are able to answer, or the viewers or participants?
Yes, ma'am. I can see few of them are answering still. Meanwhile, can we delete few options? Why it is not? So let us think in case if it is A. So lack of basic information and simple courtesies.
Here,
why is not the answer? Kesson is saying it is B. Okay,
yes.
Let us take that one. That is absence of attention to communication. And Rinsi is saying it is D. Muni is saying it is B. Jemmy Verghese is saying it is B. So many are answering. Great.
What about the answer for D option?
So the answer is all the above.
All of the above. Yes. Because so here, if you see A, B, C, D, all the above factors were missing when the client has entered firstly to the OPD level. Nobody has guided her. The attention was not given to her communication, and the required basic skill of communication which healthcare workers should have, they did not have. So all of the above is the right answer. We can go for the second scenario.
Before that, I have a question for you. Why this answer is D, as the keynote says that first impression always matters?
That's what, when I've told that the patient, whenever patient comes to us, so what is the patient is, what is patient's expectation is? Patient should be, guided. Somebody should orient the patient to the different level of, wherever she wants to go and see her, look at her doctor or take the consultation. and she seeks a lot of information. Everybody should be able to provide the information to her so that she's comfortable and she goes with the productive outcome. But here, all the factors were failed. So the option is all the above. And the keynote out of the scenario is first impression matters. First impression cannot be taken or judged or created by on the second visit. So here the keynote is first impression.
Thank you so much, ma'am.
Thank you.
We'll go for the next scenario.
Yes. Here the case scenario second is we are trying to give you, I'm trying to give you a very small scenario, very simple, very concise. You can always find out why the underlying factors, underlying marks which I have used for the content is just to give you the highlight information on the case scenario. So here Mr. Harry admitted at 3 a.m. from the ER for management of pneumonia, has history of fall, pressure sore, poor food intake. Nurse 1 who receives the patient. Upon admission, nurse 2 received handover and busy doing initial assessment. Nurse 3, there were no instructions for fall, pressure sore and diet order. You see, these are the golden thumb rule of the ISBAR, assessment. We nurses always need to find out what is ISBAR. And here the case scenario is this. Now you can talk about the options. Yeah.
Yes, I have a question. What do you think what has gone wrong in order to find solutions to his healthcare problem? That's like health problem. The options we have given you are option A, handover lapse. Option B, lapse of handover and initial assessment. Option C, patient's relatives not by the bedside. Option D is pressure sore own cultures were not sent. What do you think that has gone wrong in providing the solution for this health problem?
We can look at the box. Yes.
Yes, I can see so many people are answering. I think.
Any right answers? Anybody?
Yes, we need to appreciate if they are going wrong even still. So option A is handover lapse.
Yes, option A is handover lapse. Option B is lapses of handover and initial assessment. Here the documentation part by the nurse was not done. So it is the answer is the C option is patient relatives not by the bedside, which is again not contradicting, proving right to this.
Nalini,
D, pressure sore, wound cultures were not sent. Now let us see what is the answer.
Nalini, Dinesh, Lata, Kavita, Navina, Megha, Mali. So many people are answering. So let me show them the answer is B. That's lapse of handover, because the main thing which has gone wrong here is lapse of handover and initial assessment. Yes. Chandra, I have a question again for you. Why the keynote here is ineffective and improper communication and documentation? If
you see nurse 1, the first nurse who has received the patient upon admission has not done the initial admission there, initial assessment. Their first nurse only failed in her assessment. Second nurse was busy doing initial assessment, but there were no instructions for fall, pressure sore or diet order by the third nurse. So right from the nurse 1, nurse 2, nurse 3, there were a lot of lapses we have seen among 3 nurses. So here that is how the keynote is ineffective and improper communication and as well the documentation.
Yes, here we can remember the elements about the sender and the receiver, also about the basic communication skills that they require, where they failed even in the written skills also.
Sure, yes.
Yes, I have a third scenario.
Yes. Here the third scenario is patient. This is a discussion between a patient and a dietitian. The patient, your food has no taste. Dietitian, what is wrong with the food, sir? Patient, there is no salt and the vegetables are undercooked. Dietitian, you are getting the food that the doctors have prescribed. So please eat your food if you want to get better and go home soon.
I don't think so. If we have this type of answer, people will definitely appreciate
exactly. This form of communication and answers replies are not welcomed. So see that.
So we have a question. Yeah, we have a question for audience again. What do you think that what has gone wrong in order to find solution to his diet issue? Option A, let the patient vent out his frustration. Do not stop and keep your cool. Later on, communicate about the customized diet. Option B, provide satisfactory answer. to maintain his calm, though he is not convinced. Option C is allow the patient to be aggressive and grumble. So meanwhile, they answered, so just let us think, ma'am, do you think like if we go like not in a constructive way, in case if the dietitian has answered here, you're getting the food that the doctors have prescribed. So please eat your food if you want to get better and go home soon. Do you think that we will have certain situations?
I would like to, highlight on the keynote. I'll be rather now, I would be just speaking on it. Here, the dietitian role is very important because all the patients in the hospitals, they take the diet in, we serve them therapeutic diet. And they are on many more antibiotics. Their taste buds, everything is totally gone. Here, the patient would like to eat something little good, which is very palatable and suits his or her taste. But here, the dietitian, she understood the patient, she has heard the communication, but here she acted in a defensive mode. I mean, she has used she would have taken the constructive criticism here, which she did not, she failed. So she still said, here doctors have prescribed, you want to eat, otherwise you will not be able to go home. But this style is not been accepted. Yes. So here she need to improve here.
Great. There are so many people who are answering. Dinesh, Megha. Dinesh became a very active one. Gayatri is saying it is B. Navina, B. Most of them are saying B. Alina says it is A. Saujanya, Pravina, Deepti. So many are saying A and B, between A and B.
So how many majorities are saying B or A?
Majority are saying B, ma'am.
D. Sorry, B.
B. It's B.
No, B. Viewers, I want you all to just read the option. B is provide satisfactory answer to maintain his calm, though he is not convinced. Here, you need to convince the patient. He is satisfied now. Again, he will grumble later on when the second food or second intake of the food comes. Here, the right answer is A, always. Let the patient vent out. When the patient vents out, we cannot stop the patient. We cannot interfere. We need to allow the patient to vent out. Do not stop. Keep your cool. Later on, communicate. Give the customized diet factors. You can also have a word with the doctor. Maybe I can just increase the little salt intake or maybe a little spice like that. Then only the patient will be maintaining his cool and will be productive enough to take the diet. So here the answer is A.
And we have a keynote again. Why it is rather holding defensive conversation, accept constructive criticism to improve performance.
To improve performance, yes. So here, whenever we do the rounds and when I think nurse managers, senior nurse managers, we go for rounds, we need to always understand, here the empathy factor comes, we need to always understand, yes, the patient has a diet issue and then we can always take the constructive criticism, discuss and then customize diet or any other solution also can be given, not only in the diet scenario, maybe medications, maybe doctor visit, maybe nurse to nurse communication, nurse to other facility staff communication, all this we can always practice.
Great. Shanti ma'am, that's a really amazing discussion with very short 3 scenarios. You have covered all the 3 different professionals, healthcare professionals.
Thank you so much. And only the conclusion note is, whenever we communicate the opposite person, the best way to build trust is we need to always respect everybody, not only healthcare givers. Our prime stakeholder is our patients. Through honest and very compassionate communication, we communicate, but all the basic skills should be practiced. Active listening, right from the active listening till the end of writing and your speaking skills. You can also be a very best speaker. You can do anything when your communication is very solid and good enough. I think you can always convince not only the patient, anyone. Thank you. I think it is a little helpful note on this today's webinar, and I thank you, Prathyusha, for being my first time moderator in this session. And Dr. Amar, we just gave little rest to Dr. Amar. I would like to thank Dr. Amar also, who is not here, but he's into some other engagement activity. But he promised us that he will be viewing our presentation. And to all the digital personals, And foremost, my thanks to my Dr. PG Pavan sir, whose brain was to get this webinar on the platform, and everybody should speak, not only us, maybe many more, senior leaders and the second commands as well. Thank you so much. I urge and request all the nurses, do not be, having all kind of fear and anxiety. Just talk, communicate. You do not understand the order, ask your doctors. Your doctors also ask, they also see whether what kind of conversation you all hold. It is not always taking the patient and, beside or behind them, keep walking. No, you do ask. They'll be always they'll appreciate you to learn. Thank you. Thanks, Prathyusha.
Thank you, Shanti ma'am, for such an amazing discussion on context of healthcare communication, which is a fundamental element for all the nurses. So here I have to say that there was so much of engagement even in the audience also. Everybody are trying to continuously answer in the chat box of Facebook. So thank you so much, ma'am, for joining us today, and many more for further.
Thank you, everybody.
Please join us for the next Thursday for yet another interesting topic with more eminent speakers. If you enjoy our webinars, please do share it on your media platform. And in case if you really like us, please do hashtag Yashoda Hospitals Nursing Education and Training Webinar Series. And also tell us about your interesting topics in the Facebook chat section so that we can come up with that topics in the future webinars. So stay tuned to us. Stay tuned to Yashoda Hospitals. Thank you.